This is Dr. Samir Islam. I want to thank you for joining me today. So tonight we are going to continue our series on IBS. Last week we talked about some of the symptoms about IBS, and that includes things like abdominal pain, diarrhea, constipation, bloating, upset stomach, nausea, vomiting, but also non-GI symptoms, including things such as painful intercourse, problems with urination, fibromyalgia, sexual dysfunction, and being tired and fatigued as well. And some of the things that IBS should not cause include things like it should not wake you up in the middle of sleep, should not cause significant nausea or vomiting or weight loss, or have constitutional symptoms including night sweats or pain with anorexia, or the diarrhea should not be large volume, bloody, should not have to get you up in the middle of the night, or very greasy as well. So now that we talked about what the symptoms of IBS are, tonight we're going to talk about how exactly do we diagnose IBS? How can I tell you if you have IBS, or how can you have the clue that maybe IBS is causing some of your symptoms? What are the things that we look for when we do the workup for our patients with IBS? So one of the things that we do is that, number one, a good history and physical is probably the most important thing that we can do. Talking to our patients, knowing exactly what their history is, knowing exactly what their symptoms are, can give us pretty much the diagnostic clues that we need to allow us to diagnose patients with IBS. In fact, if somebody has classic symptoms of IBS with pain that seems to get better or worse, with having a bowel movement, with associated diarrhea and constipation, with none of the warning signs I talked about before, this alone gives us a 98% certainty that you have IBS. And so we can start treatment very quickly. We don't need to go on to further testing or further workup. And so very quickly, we can start the treatment for IBS to see if you do respond to those particular options we have for you. And so a confident diagnosis can be made based on symptoms alone, in which you have these symptoms for at least three months with a normal physical exam, and you don't have any of the alarm features like I talked about, including things like significant weight loss, bloody diarrhea, and large volume diarrhea, etc., etc., etc. The other good thing about IBS is that IBS does not have to be a diagnosed exclusion, meaning we don't have to exclude a lot of other different things that people have. We don't have to exclude things like celiac or Crohn's disease, ulcerative colitis, and most patients who have typical symptoms of IBS. In fact, if you've had normal scopes done before and had a normal workup done before, and you see a gastroenterologist with typical symptoms of IBS, that's all we really need. And that's all we really need to diagnose you with this condition, so we can go ahead and start treatment at that time of the visit. Repeat diagnostic workups, including repeat scopes or blood work, may not be necessary in most cases who have IBS. So once again, keep in mind the typical symptoms of IBS include pain that seems to get better with bowel movements, with diarrhea or constipation that's also relieved with bowel movements, that's present for a few months without any of the alarm features I talked about before. If you have these symptoms, boom, you have IBS, we can go ahead and start treatment and hopefully get you taken care of. And so the most important thing is a good history and physical. Now, in some patients who we may think may not have IBS, we may want to do some stool studies, especially if they traveled to an area that may predispose them to having a bacterial infection, or if they have some of the risk factors for a really bad diarrhea infection called C. difficile diarrhea or colitis. And for some of those patients, we may want to check some stool studies to make sure they don't have any obvious infection. Or if you have some of the warning signs, this is another reason for us to do further workup to make sure that you don't have any other causes for the diarrhea or the pain or even the constipation that you may be having. And for some people, we need to take a look with the scope. We may have to take a look with the colonoscopy and or upper endoscopy as well. These are diagnostic tools that allows us to see exactly what's going on in the GI tract and allows us to see if there's anything else that could be masking for IBS. Now, there are a lot of conditions which people have that may make us, or at least give symptoms that are very similar to IBS, including conditions like celiac disease, gluten intolerance, maybe small intestinal bacterial overgrowth, and sometimes even Crohn's disease or ulcerative colitis can have symptoms that are very similar to IBS, and it can make it very difficult for us to differentiate between IBS and those other conditions, which is why maybe taking a look with the scope, looking inside the GI tract, taking some biopsies will be an option for some of our patients who may not fit the classical definitions of IBS or who may have some of the warning signs that we want to rule out other conditions that could be going on within the gut. And also, age-appropriate screening would be important to do. If you are over the age of 50 years old and you have IBS symptoms and you've not had a colonoscopy, we're probably going to recommend for us to take a look with a colonoscopy because you are of age for us to do that anyways. Like I mentioned before, sometimes there may be some routine labs we'll check. We may check some inflammatory markers. We may check some blood work for celiac disease, or we may also do some just routine blood work to make sure you're not anemic as well. Because if you have any of those red flags, that would lead us down to a path of maybe not thinking IBS would be the cause for some of the symptoms you may be having. Now, the most important thing I want you guys to know is that there is no specific test that will tell me you have IBS. I cannot run one single test that tells me that you have this particular condition. You may see advertisements in the media, in the news, on the internet about certain IBD or IBS blood tests, and I will tell you that those tests cannot tell you have IBS or not. Now, they may be good tests in certain conditions. There's not one diagnostic test that will allow me to see that you have IBS, but I will tell you the best test that we have is just listening to our patients. That by far will give us more important information, and that by far will give us a better idea if you have IBS or not. And if you have these typical symptoms, then there's a more likely chance you would be having IBS. So in summary, keep in mind that IBS basically is a symptom-based diagnosis. We want to use the symptoms to see if you have IBS or not, and we use that to help us guide what the next steps may be. We look for the warning signs that could be causing other conditions besides IBS, and if that's the case, we may want to do further diagnostic testing. In terms of the other workup, there is no specific test that will allow me to definitively say that you have IBS or not. Sometimes it's a matter of a combination of different testing depending on what you have and depending on your symptoms, or it could also be a couple other things we may want to run as well. And so there is not one test that will tell me you have IBS or not. But with the combination of a good history, physical, maybe some other routine blood tests, even stool studies, and in some people, maybe some scopes, I feel we can confidently diagnose our patients and then hopefully allow them to get the treatment that they need.